We are back on Morning Line. Final segment this morning with Dr. Joshua Beckman. He's excellent. He's from the Heart and Vascular Institute. This is February, American Heart Month, and glad to have him on. It's real interesting. When we came out of the break, just before we came out, I asked him about going and having EKGs or stress tests, and how often you should do that. And we'll cover that for you in a moment. But you said if you are physically active, that is your stress test. For instance, myself, and being a borderline hypochondriac, at times I will say, I've got this pain in my chest. And I'm someone who can go run hills for 3 miles and then jump in the pool for a half mile or do whatever. If I was having some cardiac issues, would I feel some tightness in my chest or shortness of breath by doing those things? Maybe be able to finish it the way I do, but just say, wow, that doesn't feel good?
Yeah, so I would say if you're routinely active, the change in your ability to do your activity is a much better sign than anything else.
Yeah.
Doctors really have a hard time figuring out if people who are, say, very strong feel weakness, because to us they're still very strong. Right. So if you're physically active and you're running hills and you're running 3 miles, if you tell me I can't run the 3 miles anymore, or I feel weaker running the 3 miles, that is a much better sign than almost anything else I can do. And so that is routinely a stress test. We don't push for yearly stress tests. They're not necessary. What's necessary is when you develop a symptom or a change in your ability to do activity or something new and different. With what you just described, I would not send you for a stress test.
How often do we see marathoners just drop dead? I'm not a marathoner. Rarely. Can happen. Remember Jim Fix?
Jim Fix lived 10 years longer than all the other men in his family because he ran so much.
Very good tip. Jim Fix, famous for some of you who won't remember him, but he was an author, Winning Running or whatever. He wrote a bunch of running books and died of a sudden heart attack. And this guy was fit. At least he appeared to be.
Oh, he was really fit. So did
they miss something that could have saved him, though, maybe? Should he have known
Now,
better?
yes, then no.
Gotcha. That was years ago.
Right. So he had cholesterol, like a crazy level of cholesterol. And he had it's called familial hypercholesterolemia, or there's something that runs in his family that drives his cholesterol way up.
Yep.
And you can't outrun your parents.
Yep.
But today
we would have been able to treat it.
Yes, and he would have had a normal lifespan.
Interesting. All right, let's go to Joe. Joe, good morning. Hi, Joe.
Good morning, Nick.
Morning.
Just a quick question for the doctor. My cardiologist has recommended me my next visit to have a sonogram. Can the doctor tell me what exactly they can tell from a sonogram?
You bet.
Sure. So the sonogram, just for the entire audience, is the same kind of test that they do when they're looking at babies in the womb.
Okay.
So it's ultrasound. It's not dangerous. And if you can do anything for a baby in the womb, you can do it for the rest of you. So what they do is they take the probe, which basically looks like something this big, and they put it on different parts of your chest to take a look at your heart. And what they can see is your heart pumping function, your heart stiffness, how your valves are working. They can take a look at the aorta, which is the blood vessel that comes off the heart, and look at that part and see if it's a normal size or not. And they can tell a lot of different things about your heart just by taking pictures of it.
Oh, that's awesome. It's a window through it. So that's what it is. It's just they're going to do a routine physical and want to look and see if his heart's operating properly.
I'm sure the doctor is interested in figuring out what's going on with the pumping or the valves. That's the most common reasons.
Did we have someone online too, Rick? Did I miss that? I'm sorry. Okay, yeah, we'll take Shirley. Shirley, good morning. Hi, Shirley.
Yes, I have a question about pulmonary hypertension. Could you explain that, please?
Sure.
So again, as we talked about a little bit earlier, high blood pressure, hypertension, is generally measuring the pressure in the whole body. Pulmonary hypertension is when we are isolating the higher pressure to the lungs. And so there's a variety of types of pulmonary hypertension. And what it means is that there's a resistance to flow of the blood through the lungs. Okay, there's a variety of reasons for it. Some of them can be it could be blood vessel disease in the lungs. Some of it could be as a result of blood clots that have been there. Some of it's from rheumatologic diseases. But in any of those cases, the higher pressure through the lungs makes it more difficult for blood to get through and can cause things like shortness of breath and really be limiting to your daily activities if it gets bad enough. Luckily, there are treatments. There's nothing perfect, but people can be made to feel a lot better as long as they go to the docs that understand it and can give the right medicines.
Excellent. All right, so in terms of monitoring yourself as we kind of wrap up our conversation on American Heart Month, what are the primary things you tell your patients, or maybe even a new patient that comes in, or your neighbor who says, Doc, what do I do to take care of myself?
So my neighbors don't call me Doc, they call me Josh. But everybody else.
Josh. Okay, Josh.
So I think that it is impossible for people to go from where they are now to perfection. And so I don't ever try and have them do that. My goal is to have everybody make small steps in the right direction routinely. So, I don't think that if your diet isn't perfect, tomorrow you're going to live on bamboo. That's not going to happen. But you can cut out a lot of the fried foods, which, having moved to the South recently, last few years, I can tell you it's a routine part of the diet. We should limit that amount. We should have more colors in our diet. What does that mean? Well, fruits and vegetables obviously span the rainbow. And so we want to have as many of those kinds of foods as possible. If you have high cholesterol or you have high blood pressure, it only stands to benefit you to treat it. You can treat that with better diet. You can treat that with more exercise. And if lifestyle improvements don't fix it, well then sometimes medications are necessary. I would say and one of the things we didn't touch on that much today, any way you can stop smoking, just short of cutting off your hands, is worth it.
Yeah, that just seems like such a no-brainer. But I'm glad you mentioned it. And
it's so hard, and you should get help. There are medicines that help.
It's hard for people to quit. It's hard.
That's right.
For people want to quit, and they can't.
That's right.
But you made a good point. We didn't touch on this, especially among younger people. My son's at college. He's not into it, but he has friends that are vaping, especially among young. And we've already seen the horrible stuff that's happened with some of them with their lungs.
That's right.
But it's crazy. And in your mind, vaping and cigarette smoking, you put them in the same category.
So I have to say, Nancy Brown, who runs the American Heart Association, has really come out quite strongly against vaping, because it is not treated as though it's like cigarette smoking. But worse, if you vape a normal amount, it's the equivalent of smoking a full pack of cigarettes. And so if you do this multiple times a day, you are hitting your lungs over and over again. And smoking in general takes a long time to cause its bad effects, which is why people don't feel like they have to quit right away. I've seen too many young people in the intensive care unit now because of vaping.
Yeah, that's the difference with vaping. It can be instantaneous sometimes.
Right away. It is, and they're aiming it at middle schoolers.
Don't tell me otherwise. Some of these companies giving us this crap. If you believe that, you know exactly what they're doing. It's amazing the abuse our bodies can take, but it only goes so far. That's what it comes down to. But I like it best as you leave this show, if you remember nothing else, eat the rainbow. And me, I start with jelly beans.
Perfect.
That's a legume. They come in a lot of different colors.
I'd strongly recommend the Harry Potter jelly beans with the weird flavors like dirt and grass.
Yeah, and detergent and stuff like that.
That's right.
Of course, I'm kidding. Colored, and I make a salad with as many colors as I can. Purple cabbage and kale and tomatoes. You get red, pink, purple, everything.
It's great, yeah.
Doctor, you're terrific. I like
so much
talking
for
to you.
having me.
You take care, and thank you for coming on and talking about such an important topic.
It's my pleasure. Look, this is the central topic, right?
Yeah, it really is. It's an important thing, and it makes a difference in all of our lives. We'll see you again sometime, all right?
I love to come back. Thanks for having me.
Folks, be back with a programming note about tomorrow right after this. Stay with us.